Okay, good afternoon, everyone. I am so excited to be here today for our Lunch and Learn. I am Lauren Gates, and I'm joined by Rebekah St James, the Executive Director of the Children's Airway First Foundation, as we will be referring to as CAFF, C-A-F-F. Welcome, Rebekah. I'm so excited to have you today to learn all about CAFF. There's so much to talk about, so let's just start from the beginning here. And why don't you introduce yourself and tell us just a little bit about yourself and CAFF?
Awesome. Yeah, thank you so much for having me. I'm super excited. This is one of our first events together in our partnership. Very excited. I have been with CAFF from the beginning. We've been around for about 2.5 years now, and I'll get into our history a little bit in just a moment. But our focus, which is why we're such a good partnership with you, our focus is on the parents mostly, making sure they have the resources and the information they need to help their children with sleep and airway dysfunctions. And while we do have information that supports our practitioners out there, that's part of our collaboration with you, is because we can provide the information and Airway Health Solutions will provide all of the education.
Wonderful. And I was so thrilled when you asked me to join your board. I know Dr. Kevin Boyd's on the board as well. He's on our faculty, and there's just so much we can do together, because that really was the missing piece, was our portal for parents. We really, as I said, geared towards the professional. So when I found out about what you guys are up to and your mission, it was just a perfect match for us and everyone out there. Rebekah and I will be like fast BFFs because we have bi-weekly and we have so many projects up our sleeve. So we'll have to have another Lunch and Learn to kind of report back on what we've been up to. But we just wanted to really establish that we're working together. We know there's a missing link in some information that's more patient-based, parent-based. So we hope to close that link together, and then also guide parents on where to find airway dentists, myofunctional therapists in their area. So Rebekah, I'm going to turn it back over to you. Why don't you tell us a little bit about CAFF and your mission?
Absolutely. So I'm going to go ahead and share my screen.
Sure, please.
Because I really think, as Lauren and I talked, instead of slides, to me at this point, our website says everything a slide would say. So I thought maybe this would be a great time to introduce everybody to our website. So when you get there, you are going to see, as we mentioned, it really is very parent-based, because we want parents to know that airway dysfunction, it actually starts in the womb. So we want to make sure that pregnant moms, new moms, moms of, as Dr. Boyd likes to call them, the geriatrics, the 9 to 13-year-olds, there is help for everyone. And at every stage, as a parent and a provider, there is something you can do to help your child with sleep and airway dysfunction. So before I get too far into it, I just want to introduce you to what started our cause, how we got interested. So these are our founders, Brad and Candy Sparks, and their daughter, Savvy. And when you can read the story in full, and I highly recommend it, as well as there was our very first podcast is with the Sparks, and they tell their story, and I will never do it the same justice that Candy does. It's actually quite moving every time I hear it. But she had a great pregnancy. Everything was fine. The birth was great. She breastfed. She did everything she was supposed to. And at no point along the way did anybody that ran into Savvy identify that she had an airway disorder. And that's really at the core of who we are, because at birth, she could have been corrected with her high arch palate. I mean, she had all the signs, but no one looked in her mouth. No one was looking for these signs. So as Savvy developed along the way, as you'll see in her story, her class 2 malocclusion was there, which led to her being referred to Bill Hang. And then Dr. Larry Wolford ended up doing TMJ surgery on her and several other things. I mean, along the way, they tried. But by the time she got to Bill Hang, I believe she was in elementary school at that point, or 12. She was 50 to 80% blocked in her airway. And she had been going through life dealing with this, which led to a lot of emotional issues. She was having trouble focusing in school, and she's quite brilliant. It manifested. And she also had things that were adding to this, like the hyper Ehlers-Danlos syndrome and things of that nature. And so when she turned, 18, she had already been through a suicide attempt, a number of surgeries to correct her mouth, to bring her jaw forward, everything they could do to open up her airway. And so now Savvy is 21, and she's still dealing with the fallout from this. Again, all I can say over and over again is this didn't have to happen to Savvy. It doesn't have to happen to the 400 million children around the globe, 95% of whom are just not diagnosed with these sleep and airway dysfunctions. So that is why we are here. That is CAFF's mission. We want every child, as we say, within that first 1,000 days. That's the critical part. Let's catch them. Let's fix them before the age of 6, so that we don't have these kind of childhoods, and it leads to quite a few health issues, as we're all aware of, in adults. So that is our mission. That's what CAFF does. For our parents, I'll just give you kind of a high level on the website. So, and again, I highly encourage everyone to check out our website when you have time. One of the things I would like to highlight, we are very supportive of the Airway community and the others that are out there rallying. We're all pushing in the same direction, and we want to ensure that we're all sharing information and doing the best we can for our parents. So in working together, we have close partnerships, as you'll see, with Airway Health Solutions, Foundation for Airway Health, Sleep Education Consortium, and the Lifeguard Approach. These are all groups that we work with very, very closely. But there's also some other groups we want to make sure parents know about on here. Wellspoken, the AAPND, which we're members of, AHS, Airway Revolution, and the AAMS. These are all great resources that, like I said, we're a part of, and we want parents to know, hey, go here for more information.
And Rebekah, may I just interject here? That's
Yeah.
really what I love about Children's Airway First Foundation, is because it's so inclusive, and it's just, we just want parents to be able to go to one place and find all the resources they need. So I love that you work with the other charities. The Foundation for Airway Health is near and dear to my heart. Airway Revolution is up and coming. So it's just a nice place to have a centralized. And I think, we coined something, Airway United. I'm just going to throw it out there just for prosperity sakes. And work together just to, again, there's so many different wonderful charities that we can kind of resource and pull together to make it easy to navigate. So thank you for doing that.
Absolutely, absolutely. And speaking, just I'll do a quick plug for them just so you guys are aware. Airway Revolution, while they don't focus on children, they're currently trying to collect data. They need over 2,000 cases. If you go to their website, you can record yourself, your patients, anybody. And there's voting going on right now. They're trying to get a movie that they're working on shown at South by Southwest. Again, just to bring more eyes to the cause and get everybody pushing in the same direction. So if you have time, please go vote. So one of the other things is August 31st, we will be launching something that I'm super excited about. As we go through, you'll see there's a lot of information here. August 31st, it's going to be even easier for parents, because we're going to be launching the Parents Portal, which will have all of these resources for parents in one section of the website, so they don't have to move around as much, as well as the Clinicians Corner, which will just be basic information. It will also be directing myofunctional therapists, dentists, pediatricians to the appropriate resources so that they can get education and certification so they can work with these patients. But you'll see, we actually started really focusing on airways specifically, which is why we have, you can see all the information to let parents know these are signs to look for. We really do try to keep it as concise and clear as we can for them. But as we delved more into it, we realized, well, there's more to it. It's not just, the obstructions, there's airway management, and there's sleep health. They all go together. So that's why we have these kind of sections broken out for parents. Our resources is really where the meat is, though, for parents. We want to make sure that we have blogs that give them information, everything from breastfeeding to nutrition to sleep health, as well as questions to ask your provider. If you see these signs in your child and you go into your pediatrician who says they'll grow out of it, snoring's normal, these are questions to ask. Here's where you can go find an airway dentist that might be able to help you. Here's where you can go find a pediatric sleep specialist that knows what you're dealing with. This is the kind of information we're trying to provide for parents. Our podcast library, this started as just a way to get, again, information to parents. And as you'll see, I mean, we've got all walks of life. Everyone is represented here, from myofunctional therapists to sleep experts to nutritionists to hygienists. And then we start to pull in ENTs. We have parents on here to share their story, because what we're hearing from our parents is they just, being able to hear another parent that's gone through this journey, it's the support. So then we kind of shifted into, it's not just information, but it's let's support the parents. And so we have all walks of life on there. That's our and it's Airway First is the name of the podcast. We're on Apple, Spotify, all of the majors, if you would love to follow us.
And just to
library.
Just to clarify, this is geared towards the parents and the patient, right? So it's not going to be over their head. Wonderful.
Correct.
Mm-hmm.
And I'll tell you, and it's really interesting to me, because we've had speakers on, like Dr. Moralia for one, which is wonderful. And he speaks in such a manner that parents really understand, all the way to Dr. Felix Liao, who was, for me, that was a masterclass watching him. And he got a little deeper, so there was, more of medical professionals could understand it, but it was still engaging enough for parents. And we know that because, they respond back to us. We have a video library, and our video library, again, kind of to Lauren's point, you'll see these aren't our videos. These are all videos that we found, that I found during research, that Candy found during her journey trying to support Savvy. And we want to make sure everything we can tell parents, we want them to really understand what their child's going through. What are the impacts? What are your options? If your orthodontist comes to you and says, we're putting on retractive braces, that's a red flag, stop, but here's why, so that you can have that kind of discussion with your child's orthodontist. Not just, no, we want them to really understand why that's an issue. Recommended reading. We're always looking for information to share with parents. These are some of the books that we have read along the way that are great. But it also kind of grew into, some of our board members said, hey, this is a book that really helped me as a professional. That's why you'll see things like the dental sleep medicine book on here by Dr. Carsonson. It's not for parents, but we're finding more and more medical professionals are joining our site, checking out information. So we want to make sure it's there. Articles and research. Again, this is information over the years we have found, really just to give parents more information on really how do ADHD and oral issues connect. Your child was diagnosed with ADHD, maybe, but have you checked to see if they have any of these other symptoms? Because perhaps it's an airway disorder. Things of this nature. Just really more in-depth scientific research and studies, as well as some quick questionnaires that they can just download and just to see, does my child have these things? And then another section that we have here, this is where we start to support now the medical community. Again, everything on here, while it is for dentists, doctors' offices, myofunctional therapists for their offices, it's still geared towards the parents. So I know that ADA, which we'll talk about, has a really great sleep brochure. This one is 100% geared toward parents. What do you look for? Why is this important? What questions to ask? And this is just something you could have in your office to give to them, as well as these posters, which you will see behind me here. Because one of the things that we learned with Savvy, and now we've done research on it because of this, there is such a mental and emotional impact to children with sleep and airway dysfunction. It's just not talked about. So depression and suicide is very high. We also know that the Surgeon General made this one of his top priorities. So we want to make sure that's where this poster came from. We really want to support that, anything that we can do for that. So that's really the crux of kind of our website and where it is and how it's geared for parents. And one of the things that we ask is, hey, if a parent walks in and they have questions, send them here. Because not only will they find a lot of great research here, they'll also find things like our Facebook support group, which is called the Airway Huddle. Other parents coming together, sharing information. It is a private group. We do control who comes in and out of it. It's not for parents to find cures. It's for parents to find support in their journey.
Wonderful.
Yeah.
I also want to bring up that you're not alone with these brochures. I find a great resource is the ADA Airway brochure, because I feel that coupled with the brochures that you have available, it's a home run, because you get the validation from the ADA seal. And I know that Dr. Carstensen and Dr. Gerald Simmons, Dr. Kevin Boyd, they're all working on this task force to really promote pediatric airway health. So we're going to see more and more resources that, again, you can have on this hub to kind of have in one place.
Absolutely. And you'll see that kind of information when it launches on the 31st in the Parents Portal and the Clinicians Corner. Because again, our one goal, get information out there in the hands of the people that need it and just save as many lives as we can.
Absolutely.
And kind of to that point, by the way, if anyone is interested, both parents and medical professionals, and I will caveat this with, you may see, there's 5 myofunctional therapists on here and you're a myofunctional therapist and you think, I can't add to the conversation. Yes, you can. Because the same message may be said by 5 different myofunctional therapists that are guests on the podcast, but maybe that 6th one says it in a way that it resonates with a parent that never heard it. So if anyone is interested in being a guest on the podcast, medical professionals and parents, just go to the website, click and join us. We would love you to be a part of the conversation.
Wonderful. And I'm so glad that you're showcasing these podcasts, because a lot of people don't know about them. And here you are, you put so much work behind it and there's so many nuggets, and just seeing everyone in one place is really motivating for professionals and for parents, I think, as well, that this isn't just a one-off fluke kind of fad.
Agreed. Absolutely.
Wonderful. And then did you want to review anything on the Clinicians Corner at this time, or do you wanted to hold off on that?
I'm going to hold that, and I encourage everybody that is on the webinar today, please join us August 31st on the websites. They are both launching. And again, Clinicians Corner, our main goal is really to support our partnership with Airway Health Solutions, because that's where the curriculum is. That's where the education is. We just want to make sure that we are covering both parts of both groups now with what we do on the website.
Absolutely. We had some questions mailed in, but a lot of these are more clinical questions that would be better geared to when we have our conversations with clinicians and experts on that. But there is, let me see if there's one question that came in. I guess one just came in. Is there a seminar for orthodontists who already address airway issues with parents and patients? So I think all of our conversations are coming from airway orthodontists that we have archived, so you can kind of get feedback from how they do it, why they do it. And we all have that we have that archived in our library. All of the recordings are free on Airway Health Solutions. And I think you have our conversations linked to your videos, correct?
Correct. Yep.
That's helpful as well. We recently just had a masterclass with Dr. Kevin Boyd, Dr. Ben Moralia, Dr. Brett Christensen, and Dr. Steve Carstensen that is also on our website and our YouTube channel. So that was a wonderful 3 hours of information that you can hopefully.
Fabulous.
Thank you. I love that that masterclass. In fact, stay tuned. We're going to have another masterclass coming about bruxism and night guards and TMD. There's so many mysteries and questions behind that. So we will be announcing that shortly. And I also know that you share that on your website. But Rebekah, I always like to dive into, we're all kind of part of the solution here, and everyone can just do their part. Can I ask you personally, what got you interested in Airway Health and joining CAFF?
Absolutely. It's kind of a wild story. It's one of those things you don't understand life until you do. And, I grew up, my voice has always been low, never had an issue, never had any medical issues, anything. Was athletic, was in band. Went to school, the plan was med school. Kind of changed and ended up in the .com world, Match.com of all places. I was one of the original 49 hires there. So a world of online dating, you're welcome. And after spending several years there, really learning about marketing and website and web development and all of this, and I really enjoyed it, but it was a job. And along the way, I traveled, moved around the country, made some very close friends. And one day, after having my daughter, who's now 21, she was born the same year as Savvy, and just out of nowhere, I started having breathing issues. And this helps me empathize with some of these parents, because I kept being told you have asthma. I kept saying there's no way. I was athletic, I was in band, I don't have asthma. And we tried allergies, well, that didn't work. And it just kept getting worse and worse. And after 2 years, finally, somebody at Baylor was scoping me, and she noticed something that was unusual and sent me to UT Southwestern in Dallas, alma mater. And they told me I had something called idiopathic subglottic stenosis, which is 98% women. It seems to show up after we have children, somewhere in our 30s, between 30 and 50. There is no cure. And being idiopathic, obviously none of us were ever intubated. So we're not in that group that gets scarring from that, but it's scar tissue that shows up in your trachea and it asphyxiates you. So they have to go in and remove it. If you'd like to hear more, we did do a podcast on it. It's with Catherine Anderson. So, I deal with this for years and years and years and years. I come to Michigan. I had to leave my home state of Texas because it was literally killing me with the heat and the ozone. I was having, the last year I was there, I had 7 surgeries in 1 year to try to keep it open. Came to Michigan. I'm now being cared for by an amazing group at University of Michigan. And while I was here, one of my closest friends in the world, who I met when traveling the country, called and said, hey, I have this friend. They're starting a foundation. They need somebody. And I said, you need Rebekah. And I met Candy and Brad and immediately fell in love with them and Savvy, and realized I've now come full circle. Here's where my biology, my years in the .com world, and my breathing issue are all going to come full circle. And so now it's my chance to help children not end up like me. And that's the way I start every day.
Wonderful. I love the serendipity. Always a story. There's always like a purpose, a drive, a calling, a passion. And everyone who's on this webinar today, thank you, because you also share that passion, or else we wouldn't be doing these lunch and learns, because we wouldn't have an audience, right? So we're all part of the solution. A lot of these questions, like how do you get an ENT to remove tonsils and adenoids? Obviously, we can't give you those answers. All we can do is give you the resources from experts who can have peer-to-peer conversations. So specifically, I had that question asked a couple of times. Our Airway chat number 45 with Dr. JJ, Dr. Jahandran. He has a wonderful hour conversation on the key to upper airway health, and that's coming from an ENT. So perhaps you want to do maybe a lunch and learn, or just share that YouTube with an ENT in your area. I mean, you can only do what you can do. You can't make people understand. And a lot of it is just, they don't know what they don't know. So Dr. Boyd is so gracious and deal with patience rather than frustration. Really, they don't know what they don't know. We can just try to give them the information. And then all of these diagnostic questions, that's not what we're here for. We're not here to tell you how to get parents on board. That's really coming from our experts, that between the both of our podcasts, I'm sure we have pearls of information, and there's really no shortcuts to learning. Unfortunately, you just got to watch them, share them, take away your pearls, introduce them to your communities, because I didn't know about CAFF until just a year ago, and I'm thinking, wow, if I knew about this sooner, how much easier it would have been for me to help our doctors get the resources that are just sitting there on the shelf. So that was really the main purpose of today, was to make sure that everyone's aware, and then to support the Children Airway First Foundation, so we can do more work together and propel this forward. Do you want to tell us a little bit, Rebekah, about who's on your board, your advisory board? I think that's so impressive.
Yeah, and before I forget, you mentioned something that I would just like to add to it. One of the things we say repeatedly on our podcast, and I've had to take this to heart as a parent too, because I've been that parent going, I miss this, my child snored. Oh my gosh. Please, 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 when working with parents, just remind them it's okay. You don't know what you don't know. Here's where we are now. Here's how we're going to help your child. So please, because there's so much guilt that the parents that we work with are carrying. So anything you can do, focus on the child, help the child, but please love on those parents. They're doing the best they can. So,
right. Yeah. Tell us a little bit about your team and your board.
Yeah, absolutely. So I'll give you a little bit about our team first, because that's the easiest. So obviously Brad and Candy, those are our founders. Cam Strong, he's director of insurance and advising. He has a really great and an amazing career that he's had in the health insurance realm. So he's bringing a lot of insight to us with, how do we guide parents? How do we help support some of the professionals that are saying, I want to treat a child with this, but how do I get it through insurance? That's kind of where that's coming from. And then obviously Savvy is one of our key consultants, because she is the reason we are here. She is what started this journey for all of us. Then myself and our social media manager is Ryan Drawn. So that is our team. And our advisory board, I have to say, I will gush about them because they really are just some of the best and brightest luminaries. And we are so honored that they are part of our board. So Becky Andrews is in Austin. She is a naturopathic physician. And she's provided some really great insight, especially to working with some of our moms and making sure that the moms and the new babies have the right nutrition, giving us guidance on that. Obviously, we have Dr. Boyd, who we love. There's podcasts and videos and things that you can listen to that we've done with him. So I won't say too much, but everyone knows who he is.
And if I may interject, he really provides a wealth of resources and research
to
really back up everything. So he's really like a backbone of driving this forward with the research that exists. When you take his mini residency, he gives you like a folder of PDFs. He actually has them spread out all over. It's very impressive.
And I'll tell you, several of those are on our website. And one in particular, if you haven't already read it, it's under our resources, the Dunedin study. Phenomenal. It really will put things in perspective for you. So I highly recommend that you check that out. Chris Duval in the world of dental hygienist is a name everyone knows. And loves, absolutely. And that's another thing. Chris really does, for me, embody, as does Dr. Boyd, but really everyone on our board, but the passion that drives the people that are involved with CAFF and why we're here and why we give so much. Because she is literally on a mission to save the world and make sure every hygienist is now looking for these signs. As she says, we're not just there to scrape tartar. So she's amazing. John Finnegan, he supports us with public health. Really is one of the two drivers behind all of our public health initiatives that we're working on. because one of the things that we have discovered along the way, and I know Dr. Boyd deals with this, addresses this once a month with some of his work. Inner city children are so underserved, it's really around airway and sleep, because they have all of these things are contributing to their airway and sleep issues, the noise, the pollution, even to, allergies that are caused by the apartments that they lived in, or roaches, or just whatever it is. So he's really one of our strongest advocates for that, and it really helps guide us when it comes to public health. Obviously, we have the wonderful Lauren, who is already on here. Dr. Hall, I will tell you, if you don't know anything about cranial sacral, I believe he is our second or third podcast. I think he's our third. Please go listen to it. It was one of the most interesting things. I knew nothing about it, but he brings in so much of the natural side of healing, and really addresses, for me, it's mental as well as physical. So he's outstanding. A great book that's in our resource library as well, The 7 Tools of Healing. Dr. Hang, he is one of the first providers. I think everyone knows who he is. He is one of the first providers that came in to really try to help Savvy and re-steer the ship with her. Amazing knowledge. Dr. Dana Johnson is our second on our public health guidance, I guess. She's amazing. We have several papers that she has written also in our resources that I recommend anyone wanting to know the impact of public health and really how deep it goes as far as airway and sleep. She's got some great papers. Check out our resource area, please. Dr. Cottigal is just an absolute luminary in neurology, and he's one of the ones that's really driven it home for us, and it's the first 1,000 days. That's where we need to be focused. That's where we've got to really, really change how we work with children and pregnant moms. That first 1,000 days, that's your window. If we do it right, we're going to have so many children that don't end up in the geriatric 9 to 13-year-old age. Dr. Susan Maples, she's actually here in Michigan. I think she's a name that everybody knows because of her background. And we have a great podcast with her, which I invite everyone to go listen to. And if your parents are looking for a book, she has one of the 3 books that we always recommend, Brave Parents. It is in our recommended reading list. Dr. Lim's Sleep, Breathe, Thrive. We recommend that one as well. And then Sharon Moore's Sleep Wreck Kids. So if you want to support your parents, those 3 books will give them everything they need. Francine is, I just don't even know really where to start with her. Her wealth of knowledge is amazing. From just really how airway works and really the whole oral complex, and talking about curriculum and how we can reach up and coming dentists and pediatricians and hygienists. And she does have an international presence because she has offices in France and in Florida. Absolutely just brilliant, phenomenal. And of course, the amazing Sharon Moore. I think everybody does know who she is, and she will be speaking at the sleep conference in Brazil this year. James Nestor, the author of Breathe. Dr. Santiago, she is up in the Seattle area, I believe in the Washington area, has worked closely with Dr. Hang as she's come up and been trained. And when I tell you she has a fire for pediatric dentistry, she has an inferno. She just sleeps and breathes, and every when she has a spare moment, she's getting more training, or she's off doing a webinar, or she's sharing her knowledge with others. It's truly amazing. Dr. Simmons, he is a neurologist. He is in the Houston and Austin area. he's the one that helps guide us specifically when it comes to sleep and the impacts there. And if, by the way, I will go ahead and plug his conference. It is in April of next year in Houston with the Sleep Education Consortium. And then finally, the amazing Dr. Larry Wolford, who I think is kind of the same level with Dr. Heng. Everyone knows who he is. But he is absolutely one of the best down in Texas as far as TMJ and oral surgery. So as you can see, I mean, we really are truly fortunate and blessed with our board, and we cover the gamut, of everything that we need to help support parents.
Right. And we're so appreciative of what you do. And I know that the purpose of this webinar was just to show everyone the resources to where you can learn more. Obviously, we can't teach everything in half an hour about Airway. So that's why you did such a nice job of just having the resources of where to learn, how to access the resources, kind of the backbone behind it, the mission behind it, the advisory board. I love the diversity you have and just everyone's different expertise coming together. So I'm so honored to be part of that and really look forward to working with this wonderful board. Is there anything else you wanted to say before I kind of wrap up with what's coming up on our end about Airway Health Solutions? Just kind of a closing remark, or perhaps what you envision in the next year or so.
Yeah, thank you for that. First and foremost, I would thank everybody that is here participating today, because you are the people that are going to change the course of how we treat children when it comes to sleep and Airway. So thank you. Thank you for taking this initiative. Thank you for learning more. And please, please, please share this information on our website with your parents when they have questions. And if you happen to see something that we're missing and it needs to be added because parents are asking you, just shoot us a note, let us know. But like Lauren mentioned, we're here to provide information. It's not about us, it's about the parents, how we can support them. And just kind of on a personal, I'm super, super excited and honored to be working alongside Airway Health Solutions. And I'm very excited for the projects that we have on deck and for our Airway Palooza that's coming up in March. So thank you so much.
Thank you so much. And I know there are some questions. One was actually about medical billing. I know that's not a resource that I provide or you provide, but I highly recommend going to the Nearman Practice Management Group. They are wonderful. And maybe, Rebekah, you can add that on there. People are looking for resources.
Absolutely.
People are asking just about our coursework, about where they can can learn more. But here is the foundation CAFF and then the QR code, but everyone should have the website by then. And we do have our mini residencies coming up, and this is professional. So this is now doctor based on how a doctor can become an airway dentist. And then they are on our airway dentist locator, which is utilized immensely. I get posts every day, questions every day where they can find an airway dentist. So if you're looking for a dentist, you can go to our airway dentist locator or the CAFF website. Or if you are a dentist who wants to become an airway focused dentist, we do have our mini residencies with Dr. Ben Moralia, who I fondly refer to as the Mr. Rogers of Airway, if you would, right? He just kind of simplifies everything. And he just puts everything so you can integrate his 30 years of experience into your clinical practice. So we have courses coming up September 15th and September 22nd. They are all virtual. And then we do have a live course October 6th in Fort Lauderdale, Florida, and then another virtual course for adults coming in November. I love this course. It's our advanced mini residency with Dr. Kevin Boyd. Again, a prerequisite is taking Dr. Moralia's pediatric mini residency. And this was a prerequisite set by Dr. Boyd because he took Ben's mini residency and he wanted everyone just to have that baseline knowledge with working with children on the older level, when he says older, over 6, and then he focuses on the real little ones with fixed kind of BioBlock expansion appliances and removable BioBlock expansion appliances, and lets you know how to deal with the behavioral components and the parent consult. So it's a really wonderful 2-day course. That's October 7th and 8th, and Dr. Moralia will also be there joining as a special guest. So this is available virtually. We have our advanced 2-day mini residency with Dr. Ben Moralia. That's 100% virtual, October 13th and 14th, where you learn fixed expansion in older teens from like say 12 to 19, and then a bracket and wire technique with springs using the carrier system, SLX system, on how to do expansive techniques with bracket and wires. So that's a must-see course if you already are an established airway dentist and want more tools in your toolbox. We love our Mayo courses. We love Team Mayo. We have really something for everybody. We do have our 8-week Mayo practice for the RDH. If a hygienist is looking for an intro course to become an oral facial myofunctional therapist, that'll start October 4th. If you prefer more of an on-demand format, we have that as well. So you can see we really have a menu here of different myofunctional courses that I do invite you to see our website, airwayhealthsolutions.com/Myo, and see what may be the best option for you, including our mini Myo course, which actually Dr. Boyd facilitated that happening because he demanded it. And it's been a sold out course with wonderful reviews. And then we have everything from our Myo Solo Success, which is about business, to then if you wanted to merge Myo into a dental office, we have that as well. So we always love your feedback, anything you want to share with us of upcoming courses that you feel would be helpful for you as a new practitioner or an established practitioner, please reach out for us. We're really excited about this program. This is our first orthodontic mini residency with pediatric airway orthodontics with Dr. Brett Christensen, who is an orthodontist for over 30 years and really has the same philosophy of Dr. Boyd and Dr. Moralia. So it's kind of a serendipitous, if you would, that we all came together. So he has so many pearls and is going to be sharing so many videos of how he does things in his practice. That'll be September 29th. Again, that's 100% virtual. And we all know and love Dr. Michael Gelb. He's kind of the TMD guru. So he's going to teach you how to incorporate TMD, treat the acute TMD patient, getting them ready for orthodontics as the ultimate solution. So Dr. Moralia and Dr. Gelb work firsthand together for over a decade. And now Dr. Gelb is going to share with you how you can treat the acute TMD patient to get them ready for ortho. So that's a wonderful course, virtual, October 20th. If you need a myofunctional therapist, you don't have one in your area, we don't want that to be a barrier. So we have the telehealth option with Brittany Sierra, and she's wonderful. So you can reach out to me if you need to get in touch with her. She's a wonderful resource for both children and adults. And Rebekah, this is so funny that you mentioned the Airway Palooza, because that's when I first heard Candy stand up. She was just so moved by, I think, Dr. Moralia's case that was very similar to Savvy, and really brought the house down with tears and chills and hugs and just amazing, amazing, amazing what we can do, what one person can do. And then when you collectively come together, the energy and the synergy is palpable. We really had a wonderful celebration last year, and this year we're really happy to have CAFF as our diamond sponsors, so we can help fundraise and do things together more in the future and get everyone the resources they need freely. So that would be wonderful. But look at this lineup. I mean, I don't even know. I can hardly wait for this event. So we will be sending up a follow-up email to those who registered, and then you can have payment plans if you want. We try to make it easy, and hopefully we'll see a lot of you at Collaboration Cures. We do have a coupon code. It's not too late to register. Dr. Boyd and Dr. Moralia will be speaking there, as well as all the other experts that you know and love in Airway. So there is our coupon code, and our website. The website is aapmd.org. And here's just our doctor locator. I think I may have missed that. Yeah. So we even have more dots here. I still don't know what's going on in Montana, but if there's anyone in Montana in the house, we need a couple of green dots there, and Nevada, I believe, too. So we may have one dot in Nevada, but you can see it all started with an idea And we're really thrilled to be able to share the knowledge and really propel airway health forward. And thank you for being part of our airway health movement. But once you take our pediatric mini residency, you'll be on the map and you will be getting new patients. It happens every day. And we're also global. So we're trying to push that a little bit more. That's one of our agendas, because children all over the world need to breathe, sleep, and thrive. We invite you to join our Facebook group as well, Airway Health Meetup. It is private, but it's for all practitioners to join us, and let's talk everything airway. So we have resources, and I can keep you updated what's going on with CAFF as well. So I think that was pretty much a full hour. We're up to the almost the hour, so you can get an extra 15 minutes. Just a couple of questions here. Jasmine, I see I can answer your question. Is you don't need a degree specifically to become a myofunctional therapist. It's within your scope of practice if you're a licensed dental hygienist or speech language pathologist or other ancillary healthcare professional. So it's just an adjunct under your current licensure, depending on your state. So there's no myofunctional therapist degree per se. It's under your scope of practice as a healthcare provider already. And the rest, I'm going to just, all these questions that are more technical, I'm going to gear it towards the experts on the podcast that will answer it. We do appreciate everyone joining us today. And if you have any suggestions for us, you can email me at info@Airway Health Solutions. Rebekah, what is your best contact information for people to reach out to you?
Absolutely. It's info@children'sairwayfirst.org.
Okay. And you know, I'm really excited for, Rebekah.
What?
Is our next lunch and learn, when we're rolling out and sharing out all
I
the
can't wait.
I had to tease it just a little bit, but we have good things, and working with your wonderful board, our wonderful faculty, our wonderful audience here. You know, we're getting a lot of people signed up for our master classes and our lunch and learn. So I think we had close to 200 registrants today in the middle of the afternoon. So you guys keep showing up. We'll keep providing the resources you need, and together we will make a difference. So thanks again, Rebekah. Please give my regards to Candy and the rest of the organization, and you'll be hearing from us soon. Take care, everybody.